Hi, welcome. I'm Bree Fowler. I'm on the marketing team here at Teeter, and today we have a very special guest with us. This is Roger Teeter, the founder of our company. You may recognize him from the infomercials on TV. Thanks for being here with us, Roger.
It's great to be here, Bree.
Great. So last week we asked some people to submit questions that they have for Roger, and he's going to be answering them live on the air today. So if you didn't get a chance to submit your questions in advance, then you can leave them in the comment section below this video, and we'll try to get to them if we can. Before we get started, I just want to say on behalf of everyone here at Teeter, very happy birthday to you, Roger.
Oh, thank you.
You just celebrated turning 80 this week,
Big
right?
8, oh, yeah.
How do you feel?
Actually, I was getting out of the shower and saying, I don't remember my body being this wrinkled last week. What can I say? Yeah.
I don't know if it happens that fast.
You just feel like you're going over the top.
Yeah.
No, I feel great. I'm doing very well. I got out water skiing yesterday
That's
and
awesome.
had a great summer. So.
Was that your big celebration for turning 80, getting out on the water?
Well, I did that and, a number of things, a bike ride, and, I spread them out. I don't do all this stuff on the same day, but water skiing's my thing in the summer. I love it.
Awesome. Cool. Well, let's dive right in. So for those of you just joining us, welcome again. We're going to kick off the Q&A with Roger now. So we got questions sent in from a mix of current Teeter customers as well as people who are just interested in learning more about Teeter and want to know if it's right for them. So the first few questions are just general questions from people who are new to inversion, trying to decide if Teeter's right for them. So Dave wants to know how long it takes for serious users to feel results. He suffers from chronic back pain and bought an inversion table a couple weeks ago after his doctor recommended it. He's been using it for 2 weeks now, 3 times a day at full inversion for up to 10 minutes. So how long should it take for him to start feeling results?
That's a very personal question, and it varies from person to person. A lot of people find benefits literally the first time they try it. But do keep in mind that whatever brought you to the point of chronic back pain was an accumulation of years, that is gravity adding compression to your body, and lifestyle. So the chronic back pain likely didn't happen overnight unless it's a specific event. And so reversing it may take time. 10 minutes, one thing I want to ask you is 10 minutes seems pretty aggressive for a first-time invertee or somebody that's just beginning. Be sure that you do not go beyond an angle that you're totally comfortable with. I mean, the whole benefit inversion is decompression, so that you take the pressure off that sore joint, that pinched nerve, help to correct misalignments. And that won't happen if you tense up at all. So don't make this a challenge like you're going to be tough and really log up some time. You want to go to the maximum angle that you're totally comfortable with and relax, and then do some gentle mobilization. Add to that angle as you feel comfortable, because the more the angle, the more the stretch. That's true. But as far as how long does it take, it really depends. I mean, FDA says, for example, it's for herniated discs or sciatica or degenerative joint disease. Those things can respond fairly slowly. Whereas if it's a misalignment, you can decompress the first day and it gets self-realigned. That would be almost an immediate fix. So this is, it really is personal. The thing I'd like you to do is think of it as a regimen. Do it on a regular basis. Keep it up. Don't get overly preoccupied with results, but stay to the regiment that I'm describing, never going beyond an angle that you're totally comfortable. And I think that you're going to find virtually everybody notes substantial improvement within a month to 6 weeks.
Okay, great. Verna says she loves her Teeter and can feel the difference already. She's had her Teeter for 3 weeks and is using it twice per day, but feels like she needs more release. So she wants to know, how long should she wait before turning all the way upside down into full inversion?
It's kind of the same answers I gave the last time. When you have to never go beyond an angle where you're totally comfortable. So if you have been at an angle that you think you need more decompression, you have really 2 options. One is use the traction handles, set the tether strap as you must be doing, and then mechanically use traction handles if you have those to further decompress your body without adding more angle, just further decompress it. The better way, because a lot of the benefit comes from relaxing simultaneously, is to add a little more angle, a little more angle, a little more angle. Don't go from wherever you're at 45 degrees and then go to full inversion. Just add a little bit each day, making sure you're totally relaxed with it. Listening to your body. You know, that's really the question on both of those, the last two questions. Listen to your body. You're not really doing anything here but relaxing. Gravity's doing the workout. Just feel your body and decide whether you can add more inversion or you've had enough and stop.
So Linda's a foster parent to 3 young boys, but has been having a lot of lower back pain over the past year and is making it difficult to get around. So she wants to know if Teeter will help her.
I think that's what it's designed for. I think 3 little kids. I got 5 little grandsons. Actually, one isn't so little anymore. But let me tell you, when they're coming over, I need to hang again after they leave. Absolutely. That is what it's for. The fact of having the activity of young children and trying to keep up with them just adds to compression that you normally have with less activity. And inversion is a great way to give your joints a break and to recover from the activity, trying to keep up with those grandkids. Believe me, I know what that amounts to.
So we have a question coming in from the comments.
So Anita would like to know, what is a good beginning regimen to follow if you're just starting out?
Just starting out, well, first of all, I would pick an angle that, this isn't set here. I'd pick an angle that's pretty shallow, not more than 45 degrees. In fact, it could easily be, 20 degrees. The important thing is, again, that you pick an angle, that's a pretty shallow angle right there. I think that's a great angle to start at. There's a little disorientation sometimes because you're doing something that you haven't done, and you want to have a chance to train that out. So pick a comfortable angle that and listen to your body. You have to be able to decompress and elongate to get the benefits that FDA says. And I'm sure you've read the 10 benefits and trust that your issues fall within those. And just listen to your body. When you think you've had enough, stop. When you think you can do more, extend the strap and go to a little more angle. I'd like you to work up to the angle of the rear legs. That's about 60, 70 degrees ideally, but only if you're comfortable with that angle. Most important, do it on a regular basis. 3 to 5 minutes. You don't have to be longer than that. Or whenever you feel comfortable. You can go longer. There's nothing negative with going longer. And maybe even 3 minutes is too much initially. So listen to your body. Your body knows what's good for it. But do it on a regular basis. Most important, immediately before bed, but also during the day after or before some activity.
As a add-on to that, Jenny asks, what is the maximum time we should be in full inversion? So can you address kind of that time?
There isn't. Again, it's still the same answer. The longest that I do it is 10 minutes. But that isn't because I couldn't do it longer. I just feel that it gives me maximum decompression. I'm not going to get any further elongation. But I typically don't do 10 minutes. It's much more shorter periods. Is there a time? I know people, I know doctors that typically hang 30 minutes every day. In fact, there's one book out by a doctor that talks about that. But even people hanging for an hour, not necessarily a full inversion. The bottom line is you need to listen to your body. Do not exceed being totally comfortable, relaxed. When you think you have enough, if you start to tense up, stop. You're working against the benefits.
Okay. So for those of you just joining, again, welcome. We're here with Roger, and he's just answering some questions about Teeter inversion tables that people sent in. So he just went over some of the questions about how long it takes to see results and how long to wait before going into full inversion. So the next set of questions all have to do with current Teeter users who are having trouble finding balance while inverting. So Glenn says that his weight shifts while he is inverting, and he hasn't been able to find a good balance point. He can pull himself up, but it takes a lot of arm strength. So is there a quicker or easier way to get back up from inversion other than relying on his arm strength?
Well, there's actually three things that affect weight shift and therefore how easy it is to come back. For example, one that a lot of people forget about is the foot setting. This is for, that's for big shoes, this is for small shoes. Now, what's the purpose of that? Well, if you're clamped, I'm going to put it on the big shoes once. And let's say you clamp yourself, and then as you invert, not only is your body elongating, but your feet, see how my feet lift off? That's an inch and a half, 2 inches of weight shift that is causing me more difficulty coming back up. I have a weight shift from body elongation, I have a weight shift from internal organs moving, and I have a weight shift on the feet. So what you want to do is set the foot platform so that it is the least slop, so to speak, between when you got it clamped. See, I don't get any gap there. So that eliminates one of the problems that causes you to have difficulty getting back up. Obviously, setting on your height is only a guideline. It is true about 80% of people balance right on their height, but if you've got a weight distribution, you have a bigger chest, you have a bigger lower body, whatever, the putting it on your height, you're going to have to adjust it an inch or two on either side of that height. That's why we want you to have a spotter the first time. Set it on your height, make sure about the slop on your clamping your shoes, and then just see where your balance point is. Are you in control so that you can go back up and forward? Now the third thing are the roller hinges. These hinges here, they're kind of a one-time setting in a sense, and the instructions that come with the table suggest weight ranges for each one of the settings. One way you can think of it visually is that this pivot point needs to be at my center of mass. Not only my center of mass lengthwise, but my center of mass thick-wise, as far as the thickness of mine. So if you have this set on for a person that's 120 or 30 or 40 or 50 pounds, and you're 200 pounds, what you're going to find is the table will be hard starting, and then it'll go over really fast, relatively fast, and then you'll have trouble coming back up. So you need to put this hinge setting on one of the other settings. Let me show you the easiest way to do that, because it is awkward. Get this that off. Easiest way, put the bar on your table, and there's two locking hinges. You unlock them both at once so that you can lift it out at once. If you lift one side out at a time, it'll ratchet. Now that puts it on the second hole, and I'm going to, just to show you, I'm going to put it on the third hole, for example. That's the one for the heaviest people, and it slows the table down the most. Now I want you to see the difference for me. Now I have it on the top setting, but okay, I've changed no other setting, just that hinge. Now I'm going to raise an arm, and you can see I'm hardly moving, you know, and even two arms, that's it. Now I will put it on a more aggressive setting, which is the one that I actually use, and you'll see that the responsiveness is much greater. And cam locks open. And I'm going to do exactly the same motion. I've changed no other settings. So here I've got one arm, and then the other arm you can see it's far more responsive. Now, one last thing, assuming that you've got it set, trial and error, you've got it set on the right hinge point, and there's the owner's manual will give you a suggestion. We got one hanging out here, doesn't? The owner's manual will give you a suggestion as to what weight range, but you need to play with it a little bit. That's why we want you to have a spotter with you. You will find the perfect balance point. But as far as coming back up, let's say, I'll just leave my hands here. Just bend your knees. It's a weight, this is a teeter-totter, if you will. So you can bend your knees, you can use the handles, or I can just bend my knees, shift a little weight back and forth across this pivot point, and just like a teeter-totter will respond. You can move the table with arm weight, you can use the handles, you can use your knees, and yes, you may have to play with all those things a little bit to get it, but I guarantee you that you will find a setting that is perfect for you. You'll have total control with using your arms to go back down, go back up.
Okay, so Rosemary had the same question. I think you pretty much covered that. Barbara has the same question, but she has specific circumstances. So she's 5'2", and she has to set it to 5'4", so 2 inches taller, to be able to use her arm to come back up. So she wants to know, and if she sets it shorter, she goes back too fast and can't get back up at all. So the longer level hurts her back. When she has it set at 5'4", it hurts her back, but that's the only way she can come back up with her arm. So she wants to know what she's doing wrong and which method you think would
check the foot platforms. Again, just you don't want any body slide at the foot level. That just complicates coming back up. The other thing is, I don't know what your setting is on your hinge. You might try setting it at, if you're at the top hinge, top hole, the A setting, try the middle hole, slow the table down, and then try a different height setting. You're going to have to play with both of those things, but you will, again, you can find that spot where you really do have total control to go down, come back up, and once you find that spot, it isn't going to change. It actually will change a little bit, because if you use the table daily, which is what we recommend, your body shape's going to change a bit, and your balance point's going to change with it. It's going to be higher up. But so after using it for a month or two, you might find you need to add an inch to the setting. But you'll also have come to be comfortable with inverting and coming back up, even at the old setting.
Okay. Last question regarding this is Chris and his wife bought a Teeter, and they have both been using it, and they're both seeing great results. Chris's wife doesn't have any issues coming in and out of inversion, but Chris always gets stuck and can't come back up. So do you have a recommendation for two people? Same
thing. Check the slop in the settings, and I don't know what their relative weights are. He could, if he has trouble coming up, then it could be that he needs to change his hinge setting to a little lower level. That'll make it more difficult for his wife to go back, but I'm sure you can find one setting. There's no reason, I think it's extremely rare that you need to change hinge settings for two different people. You can find a kind of a median that works for both of you, and it might be a little harder for her to come back up, but easier for him. But there's a good chance it's slop in the bindings or just the height setting that is the adjustment you need.
Okay, we have another question over here.
Both Raphael and Jessica want to know if the Teeter can help for herniated discs or disc bulges. Can you address
herniated
that?
discs?
Or disc bulges. Mm-hmm.
Absolutely. I mean, FDA, we're cleared as a Class 1 medical device, and FDA has specifically said that Teeter is indicated for 10 different causes of back problem, including herniated disc. Now, bulged disc is not on their list, but that's a lesser stage to herniation. So, of course, it works. I think that applies. As a herniated disc is far more it's the same problem, more advanced. But absolutely, now that kind of a injury takes longer to get results, or let's say recovery, and it's most important because it's actually a rupture, and the most important thing to do is invert immediately before bed, so that you can pull that bulge in or bulge in, or that rupture, and it's not, or reduce its extension, and go to bed in that condition, so that over the night the body can start a healing process. If you check on Newcastle University in Inversion, you'll see a preliminary study where it showed, and it was, everybody had a herniated third lumbar disc, all herniated, everyone was herniated. And it showed that inversion with the format they were using eliminated 70% of the surgeries. And the format they were using was as aggressive inversion as possible for 2 minutes, a break, 2 minutes more, a break. That is 6 sets of those, so a total of 12 minutes at whatever maximum angle you could take, and 12 minutes a break. And they did that 3 times a week for 6 weeks. That was sufficient with the a herniated disc to avoid surgery for 70% of the people. So it took time over a period of time. But you can check that study, Newcastle University and Inversion.
Cool. All right. We should just say that you should consult with your doctor before doing any new program.
Absolutely. We're not doctors. I mean, the advantage I have is I've been inverting for 36 years myself, and since we have 2.5 million tables that we've sold worldwide, we have a tremendous amount of information from people, and we know these things work. FDA came late to the table. It was only a year and a half ago that they classified it as a Class 1 medical device and gave us a list of 10 things that Teeter's indicated for. But we knew that it worked for those things well before they joined the party. Welcome, just late.
Okay, so that was a good leeway into the next set of questions, which all have to do with specific back conditions. So Pax wants to know, how can the Teeter benefit those with scoliosis?
Well, scoliosis, I mean, the FDA lists curvature of the spine by tight muscles. Scoliosis is a curvature of the spine. That's a curvature in the wrong direction, not the proper S-curve, but it's usually caused by various problems, tight muscles, what have you. But it's a curvature that is not correct, and it can progress over time to more and more severe. Inversion, again, check with your doctor. I mean, that's always the answer. But in our experience, it is an effective way to control it. It's not gonna cure it. I mean, it depends on the cause. If it's just tight muscles, then you're going to see some real net gain. But if it's something other than that, then keeping those joints supple and giving them a break, not just your constant body weight pushing in one direction against an improper curvature, adding to the problem. So this gives it a break and is a way to. You can ask. I think if you get on the internet and ask that question, you'll find that there's quite a few people with that issue that have experience with inversion.
Gail wants to know if the Teeter helps with a pinched nerve and the numbness caused by the pinched nerve.
I love that. That's yes. Of course, that's sciatica, and that is one of the prime things that FDA says Teeter's is indicated for, and it is so straightforward, so logical. These discs are kind of fluid-filled shock absorbers, and they're constantly changing their fluid content. Well, besides controlling how flexible you are and what shock absorption you have, depending on their thickness and overall health, they also control the size of the opening that a nerve comes through. So a thin disc or degenerative disc very commonly means a pinched nerve. There's 2 nerves for every single disc. And if that nerve happens to go down the leg or down the shoulder, it's going to cause you it's what we call sciatica. When you invert, you're decompressing the joint. You're taking the weight off. You're increasing the opening size for that pinched nerve. You're taking the pressure off. And less pressure is less pain. So absolutely, that is one of the primary advantages for inversion, since sciatica is one of the most common problems from lifestyle and long-term effects of gravity.
Okay, so while you have that in your hand, Jerry has grade 1 spondo and wants to know if it's okay to use an inversion table.
I think it's a short, he means spondylolisthesis. What that is, for those of you who don't know, these vertebrae are independent. They're encased in ligaments and muscles that support them, but they are pretty much independent units kind of strung on the spinal cord. The thing that controls them are facet joints. So when you rotate, these facet joints stop the rotation. But one of the problems, if this facet joint fails, if it's broken, then this vertebrae is free to move in and out. So spondylolisthesis means that usually it's this vertebrae, one of these two down, this one here, is that this vertebrae during the day will actually move out of alignment, just like this is a stack of children's blocks, and you push one of them so that it's out of alignment. That's what happens with the vertebrae. What's interesting is that is driven, I don't want to get too technical, but it's because this part of the spine is curved and your body weight is straight. Well, to resist your body weight, there's a force along the line of the spine, but there's also a counter force that pushes that vertebrae out of alignment. What's interesting is when you invert, instead of compressing your spine, it's decompressing your spine, and the force that actually was pushing it out of alignment, that same force in the same degree pushes it back. And so it's a way to control it. It's not going to, we're not talking cures here, we're talking a maintenance thing, but spondylolisthesis, I think you can do some search too. I know that we had one chiropractor that sent us a preliminary study, had 6 patients, and he had the whole vector analysis of why, just because of how we are with the curvature in the lower spine, there's a force that pushes that vertebrae out of alignment, and with the facet joints broken, it doesn't resist it. So it gets out of alignment, and inversion reverses the forces, and actually the same force that pushed it out of alignment is now pushing it back in. You really have to ask your doctor. These are medical questions, and I'm trying to give you some principles as opposed to specific advice. So don't take my advice as telling you how to do it, but do check with your doctor. And he could find an article. I can't remember the name of it, but it was a while back. It was very interesting. This chiropractor had 6 people with spondylolisthesis, and all 6 had notable reversals, temporary, but as a way of maintaining it on a daily basis so it doesn't get worse.
So Diane purchased the Teeter almost a month ago for her sciatica and back issues, and says that sometimes when she uses the table, she finds that her sciatica has flared up again. Sometimes she's feeling worse. So she wants to know if this is common and if she should continue using the table.
I think the fact that sometimes it gets worse, I wish I could talk to her to see if she can identify what's different about the times that it seems to aggravate it and the times it doesn't, as to whether, I mean, if you're talking about, was it a herniation? What was the issue?
Sciatica.
Sciatica. You know, I think it's really hard to understand without saying the sometimes part. I mean, sciatica is one of the back issues, the most common ones, and one of the ones that inversion is most effective in dealing with. Now, if it's inflamed, if it's actually inflamed, then you might be. That's a different issue. You know, you might want to check to see if it's inflamed or just the fact that it's a degenerate. It's just a pinched nerve. But inflamed, I think you should check with your doctor there.
One piece of advice that we haven't addressed is coming back up slowly.
Oh, very important. Very important. Especially if you've got, let's say you do have an inflamed joint, and let's say that you're going back and you get relief, and then if you come back up too fast, you can actually aggravate a joint that is inflamed. And I'll explain that in a second. But what you want to do is, in fact, this is good practice for everybody, is come back up to level and take, a minute, maybe half a minute, and then very slowly start to put weight back on. Here's why it mechanically can add some discomfort in coming back too fast. When you invert and decompress, you will elongate 1 to 2 inches, so all those joints are opening up, and then that disc that's hurting, along with all the other discs, are going to imbibe moisture. And this is particularly true with a herniated disc because the moisture can come in so easily because it's herniated. So you pick up that moisture, and then if you've got that disc kind of inflated with moisture, and if you come back up and throw weight on that inflated disc, you're going to get a shot of pain by hydraulic forces could be very uncomfortable. But if you stop halfway up and let the body readjust to having weight on and add slowly weight, you can eliminate that problem, essentially eliminate it. Yeah, it's good points.
So Mary, or maybe Mari, says her teeter has reformed her life, but occasionally she still puts her back out. So her question is whether she should get back on the inversion table when that happens. She says it seems to get worse when she's in a lot of pain and her body can't handle the stress of it. So how does she know when the right time is to get back on the teeter?
Well, the fact that she's in a lot of pain suggests that she's had a new injury and it is inflamed. And that's a time to be cautious for the reasons I just explained. I think the probability is when you throw your back out, whether it's gardening or chasing after the kids or sports, you threw it out. It moves. But at that moment, you're not in pain. You just think, it's tomorrow's going to be awful and it takes a while because discs are avascular. That means they do not have a direct blood supply. So the fact that it is tweaked, the body takes some time responding, and during that time it builds some inflammation, some swelling to stabilize that injured joint. Well, you've waited too long to invert. You're better off, as the U.S. Army found out, and you can check U.S. Army Inversion to see the results of their 6.5-year evaluation. But when things move out, that you want to invert the same day because whatever movement you felt has a very good chance of reversing itself before it swells up. If it's already swollen up, you're sore, you're in pain, you will have to go easy for a while until you get rid of that inflammation. And again, stopping, very important to stop halfway up at a horizontal after a shallow inversion. I'd back off on the inversion angle that you're used to, and then very, very gradually putting slow weight back on.
What do you say to people who aren't in pain anymore because they've been using the teeter and they kind of stop using it?
Don't stop. There are so many benefits. We all want to keep youthful appearance. Do you think you take care of your skin on your face one time and you're done? Or you put this, maybe you do it for a week or two and you're looking a lot better and you quit? Come on, you know better than that. It's a maintenance program. The spine is no different than any other part of your body. A regular program of proper maintenance will help you keep youthful function and flexibility longer. It helps keep a supple joint. When you invert, there's lots going on. You're helping to rehydrate the disc. You're hanging on your ligaments. You're getting a realignment, decompression. The whole area is stimulated. And through that, you can think of it as a stretching, an exercise, whatever for joints. But it helps keep those joints youthful and flexible. And so do think of it as a maintenance program. 3 to 5 minutes every day, done most importantly immediately before bed, so that you can roll into bed decompressed, and your body won't have as much trouble shoving you back in shape by the next morning.
Sagar wants to know, will the Teeter 4-week MAP program help achieve a pain-free life for someone with a herniated disc?
With a herniated disc, I think that you really shouldn't consider that week 1, 2, 3, and 4. That is a guideline, like first beginner inversion, intermediate, advanced, and then advanced. Don't think of it as it's actually a fixed week period. You really remember, listen to your body. You're not doing anything. You're enjoying a great stretch, and you can really think about how your body is feeling. Yes, you should mobilize some rotation, just some mobilizing of your body, but pay attention to how your body is and progress as you feel comfortable, adding more and more angle, adding more rotation, adding more stretches as you feel comfortable doing it. And all of those things accumulatively will make a difference, even a big difference in many people's lives.
Great. So just to reiterate one more time, if you have any questions or concerns regarding a specific back condition, always check with your doctor first. We do also have a comprehensive guide available on our website that you can download. If you sign up for that via email, we'll send it to you, and you can take that to your doctor and go over all of the stuff about inversion and how it may help specific back conditions, all the FDA stuff, and you can go over it with your doctor to see if they recommend it for you. So we have just one last question that Thomas just threw in for fun. Do you ever get recognized by people on the street?
On the street, no. I think that people walking on the street just don't notice other people walking on the street. But car rental people, immigration agents, people that do look at your face. I was trying to, people in banks, bank tellers, stuff like that. But it isn't that common. I mean, after all people, old people with white beards all look alike.
All right, well, we're going to wrap up the Q&A, but before we do, please hit the follow button at the bottom of the screen to subscribe for notifications about our next live events. We'll probably be doing another one in about a month or so you'll get a notification about what we're going to do, and if you have any suggestions on what kind of information you want us to cover or what you'd like to see, then let us know, and we'll do our best to accommodate. Thank you for coming. Thank you for joining us, Roger, and we will see you all next time.